Developing now a step in the right direction, but still more to be done before doors can reopen. Today it was announced an agreement was reached between Madera Community Hospital and Adventist Health. Thank you for joining us for Action News Live at 5. I'm Graciela Moreno.
And good evening, I'm Juan Armstrong. We're live tonight on ABC 30, Hulu Live, and wherever you stream. Action News reporter Kate Nemrich joins us now after speaking with local leaders about what still needs to happen for the hospital to begin treating patients once again. Kate?
Warren, Graciela, the deal reached between Adventist Health and Madera Community Hospital is non-binding and dependent on the hospital finding funding. The hospital has secured minimal funding from the county to cover the next month of operating expenses, but more is needed for the future.
Yeah, when we considered moving forward to consider the burn rate, we wanted to get a letter of intent. So we at least wanted to see that there was something going on. If there was nothing going on, if there was no potential suitors, then we really don't want to put taxpayer dollars at risk.
On Tuesday, the Madera County Board of Supervisors will vote on giving the hospital $500,000 for the month of August, covering the cost of keeping the Madera Community Hospital building on standby.
To keep the boilers going, to keep the airflow throughout the hospital, which is very critical to prevent mold and other things that would compromise hospital operations if and ever it ever opened up again.
That money is now more likely to be approved after Adventist Health issued a non-binding letter of intent saying it will manage the hospital if money can be secured to reopen the facility. It's a glimmer of hope, but just a first step. The next major hurdle, Madera Community Hospital is hoping to secure funds from California's Distressed Hospital Loan Program.
I'm very confident that the hospital is going to get a loan with these new partners because these are partners who have experience in California, have 17 hospitals here, a nonprofit health system, and they know what they're doing.
Senator Ana Caballero has been working at the state level to help find funding for the hospital. According to her, the hospital has requested an $80 million loan from the state program, which would be paid back over 6 years at 0% interest. Caballero says they've also worked on securing financial support at the state level, like the Managed Care Organization tax.
The reimbursement rate will be higher for Medi-Cal patients, and there will also be an opportunity for additional revenue for other kinds of services.
If approved for the California's Distressed Hospital Loan, it is unclear how that money will be paid back. Many rural areas across the state facing similar circumstances have set up taxing districts to fund their hospital. Madera's plan still needs to be determined.